The world is only as strong as our weakest health system. If we do not act decisively now, I fear the virus will establish a foothold in the most fragile countries, leaving the whole world vulnerable as it continues to circle the planet, paying no mind to borders. This is the moment to step up for the vulnerable. Older persons, persons with chronic illnesses, and persons with disabilities face particular disproportionate risks and require an all-out effort to save their lives and protect their future. We are also aware of the heavy impact the crisis is having on the world's women across many fronts, in particular losses of livelihoods, increased burdens of unpaid care labor, and heightened exposure to domestic violence. Today, we are launching a $2 billion global humanitarian response plan to fund the fight against COVID-19 in the world's poorest countries. Coordinated by the UN's Office for the Coordination of Humanitarian Affairs, this interagency plan brings together existing appeals from the World Health Organization and other UN partners and identifies new needs as well. Properly funded, it will save many lives and arm humanitarian agencies and NGOs with laboratory supplies for testing and with medical equipment to treat the sick while protecting healthcare workers. The plan also includes additional measures to support host communities that continue to generously open their homes and towns to refugees and displaced persons. We need to act now to stem the impact of COVID-19 in already vulnerable humanitarian contexts. And we need to maintain support for existing humanitarian response plans on which 100 million people depend. If such funding is diverted, the consequences could be catastrophic. The further spread of cholera, measles, and meningitis, greater levels of child malnutrition, and a blow to the ability of these countries to combat the virus. Let us do everything we can to prevent COVID-19 from wreaking havoc in places with limited health capacity and resilience. At the same time, we are doing our utmost to plan for and respond to early recovery in the countries around the globe, and that will need it most so that we achieve a new sustainable and inclusive economy that leaves no one behind. I've asked United Nations resident coordinators and UN country teams to support countries around the world in addressing the socio-economic implications of this pandemic and will require an adequate funding mechanism. But now we ask you to support this humanitarian response plan that is a necessity for global health security. It is a moral imperative and in everyone's interests, and it is a crucial part of winning this fight. I appeal to governments to give it their full support. Thank you.